We are a group of communication design students at Swinburne University of Technology, and we are interested in finding out which government health warnings on cigarette packages are the most effective in delivering anti-smoking messages. Our study is based mainly around Maslow's hierarchy of needs, investigating whether cigarette packages graphics focus on health and safety need outlined by Maslow as the first and foremost human need are more effective than graphics relating to other levels in the hierarchy. As smoking is still a commodity in today's society, this study analyzes what smokers perceive as being the most effective graphic warning in order to identify what kind of graphics would be most likely to influence a smoker to ultimately quit smoking. Rick is a long-term smoker with a son, Lucas, who is 8 years old. Having finished work early tonight, Rick is sitting on the couch relaxing while Lucas is watching an episode of Walking Dead. Sitting there on the couch, Rick is getting a bit bored of the program. He pulls out a pack of cigarettes from his pocket and gets ready to smoke as usual. Again, he sees the warning image on the cigarette packet, but this time depicting a man dealing with throat cancer caused by smoking. There is a pipe coming out from a hole on his neck, allowing him to breathe through it. Rick's reaction is the same as usual. He ignores it. Lucas, distracted by his father pulling out his smokes, sees the warning image and instinctively he freaks out and starts screaming for his father to stop smoking. Rick has had enough of it. He turns off the TV. Tired of his son's wailing, he walks out of the living room and onto the front porch. Inside the house, Lucas is still screaming for his father to stop smoking, but Rick ignores it. Instead, he stares at the closest thing available to him, the smoke packet. He suddenly realizes that the man from the warning image looks eerily similar to the zombies in the show Lucas was watching. Without realizing it, his son's screams are zoning out. Suddenly, he hears the crunch of dull footsteps on fallen leaves. Rick looks up. There are a bunch of zombies coming at him. Rick is paralyzed. He doesn't know what is going on. While he stands there in shock, the zombies are coming closer and closer. Trying to get rid of the illusions, Rick throws the packet of cigarettes as far away as possible. He crouches down near the ground and covers his head. He realizes the crunching sounds of footsteps are gone. Slowly, Rick opens his eyes. The zombies are gone. Immediately, he pulls open the door, rushes to his son's side, and hugs him. At that moment, he is happy. The danger is gone. The evidence of that is that the means from our survey responses were higher for answers that supported those claims than for alternative answers. When analyzing our self-documentation kits, we use sticky notes to form an affinity diagram. From the affinity diagram, we found patterns in areas of smoking behavior that required further research, such as shame in social situations and the level of importance placed on different aspects of life, for use in the graphic design of packets and the use of disgusting images in graphic design of packets. Our group came out with 3 qualifications. Number 1, that graphic warnings on cigarette packets are more effective if they focus on health than safety, family, finance, and self-esteem. Unless that person has children, then they are more likely to be affected emotionally by things that target family. Number 2, that social pressure or shame is a motivator for not smoking, unless that person is in an environment where smoking is accepted or encouraged. Number 3, that health messages that used more disgusting images were most effective, unless the one image is used over and over again, and then people become desensitized to it.